I've issued a plea to the business community, urging them to encourage their employees to get vaccinated. I myself have asked city employees to get vaccinated as well. I'm asking them to fight for their businesses, to fight for their families, to fight for their employees' families, to fight for the economy of Shreveport, to fight for the city that they call home. We're asking our unvaccinated community to use the tools at our disposal. When we were here a year ago, we did not have a vaccine available, and the resources that we had at our disposal were masks, and we knew to social distance, but at this time, we actually have the tools to where we can solve the problem. So we're going to continue outreach. We're going to continue to ask you and plead with you to get vaccinated. This weekend, the city of Shreveport will be hosting an event to where we will be giving $100 away to citizens, to over 500 citizens, if they get the vaccinations. We're going to continue to be aggressive in this campaign. We're going to continue to be innovative in this campaign until we are confident that our community is protected against COVID-19. You're not just helping yourselves by getting vaccinated, you are also helping your family, your friends, your neighbors, and those healthcare workers that are working diligently every single day. And I'm grateful for those heroes that are fighting for our community. We all need to step up and do our part. At this time, I'll be inviting Knox Andrews of Region 7, Healthcare Coalition Coordinator, to say a few words.
Thank you, Mayor. Good afternoon. Thanks to the media for your presence here and helping us share this word. I am Knox Andrus. I'm a registered nurse. I'm also the Louisiana Region 7 Hospital Preparedness Coordinator working with the Louisiana Healthcare Coalition. And the purpose here today is again to bring representatives of our senior leadership of hospitals and healthcare here to kind of show you and explain what's going on in their systems and the impact of this COVID Delta variant. You know, our hospitals and healthcare systems have been responding to this pandemic now since, well, before March 2020. In the last 30 days, Louisiana Region 7 hospitals have seen COVID hospitalizations rise from 31 patients July the 7th to 218 patients yesterday, August the 4th. In just 2 weeks, COVID hospitalizations have risen 128% in Region 7. The overwhelming number of these COVID cases, the hospitalizations and deaths, are among unvaccinated individuals. If you're vaccinated, you have a very good but not absolute protection against getting COVID-19, including the Delta variant, and excellent protection against severe outcomes such as hospitalization and worst case scenario, death. The latest CDC data is showing that if you're vaccinated, you're 8 times less likely to get COVID, 25 times less likely to be hospitalized, and 25 times less likely to die from COVID than if you're vaccinated. Region 7 hospitals are responding and coordinating with healthcare partners locally at the regional level, state, and federal government. But our hospital bed availability situation is dire, and it's getting worse every day. We need the community's assistance to stop the spread of COVID-19. We need citizens to get vaccinated now. We need them to follow the guidance that's been offered relative to masking, to social distance, and practicing good hand hygiene. It's so important, as the mayor said, we want you to protect yourselves, protect your loved ones, including your children, your neighbors, and your community. And with this, I'm going to turn this over now to Dr. Steen Trawick and let him introduce himself. Thank you.
Good afternoon. I'm Dr. Steen Trawick, Chief Executive Officer and Chief Medical Officer for Christus Health Shreveport-Bossier. And I had an address with my team the other day, all the associates. I sent a video message out, and I said, being from the 80s, I had to refer to the White Snake song, Here We Go Again. And unfortunately, we're in this, and it's worse than we've ever seen. The difference is we have something to treat it and to do something about it, and that's the vaccine. And we didn't have that, as the mayor said a year ago. But I want to tell you a little bit about where we are as a state. As a state today, we had 2,421 hospitalizations, and that is the highest number of hospitalizations that we have had since this began. And so that's looking at it from a state perspective. Let's look at it from a local perspective. And you're going to hear this from all the administrators that come up here and talk to you, because we're all facing the same problems. Our staffing crisis, we are all struggling for staff to take care of the patients. Our staff, they're getting sick. And it's very unfortunate, but they're tired too. They have worked tirelessly through this pandemic to take care of our community and our citizens. And I'm so grateful for all of them. Our emergency departments, you've heard that there are a lot of folks coming. So the difference is, before, where we had high COVID and we had some staffing issues, now we have those two things, plus we are still having high volumes. And that's normally a good thing, but unfortunately people are having other problems that they may have put off earlier in the pandemic. They're having heart attacks, they're having strokes, they're having cancer diagnosis, and we want to be there to take care of them. And my ER director said yesterday, he made a very good comment. He said, we're going to be here to take care of you. If you need help, come to the emergency department. But please understand and be patient with us as we get to that point. So let's talk a little bit about the patients and taking care of our hospitals. Christus Shreveport-Bossier has the highest number of COVID patients that we've had throughout this entire pandemic today in our hospital. What we're seeing, as the mayor mentioned, we're seeing a much younger population. Whereas the first part of this pandemic, we saw older folks that were getting sick and many were dying. Now we're seeing younger people. Our average age is between 30 and 50 that we're admitting right now, with our youngest being 20. We are seeing deaths in these younger populations. So whereas before we said, oh, if you've got all these comorbidities and other medical problems, you're at a much higher risk. Now we're seeing young, healthy people that are having this problem. But again, 90% of those that we are admitting to the hospital and are sick are unvaccinated. Let me say that again, unvaccinated. So that's a pretty good statistic of being reason to get vaccinated. And I urge everyone listening to this to please do that. The other part of this that we're seeing with these patients is that they're staying in the hospital longer. So we see them, and I'm sure that my colleagues are seeing the same trend. They're getting better, but then all of a sudden they take a downturn, and they end up staying in the hospital. Our doctors are working around the clock to help keep these patients off ventilators, but they're sick. And I think you'll hear that from my colleagues too. So I'll make one last plea. Please, if you're sick, come to the hospital. We're going to take care of you. We're going to make sure that you get the care that you need. But get your vaccine. They are offered all over the community every single day. If you don't know where they are, you let one of these hospital or health systems know. We can help you find that vaccine. Wash your hands. Wear your mask. Stay out of crowded places. Be smart and be safe. Thank you.
Good afternoon. Thanks for being here. I'm Chuck Daigle, CEO of Ochsner LSU Health. I want to thank the mayor. I want to thank my colleagues for being here today. I want to thank all the healthcare workers throughout this region and throughout North Louisiana for the care they're providing, both inpatient and outpatient. This is a monumental time in healthcare. We never thought that we would be back in a forced surge. As the other speakers have said today, we have the tools to fight this. This is a different surge. This is a surge where we have the ability to fight the COVID virus. The sharp increase of COVID patients combined with the extremely contagious Delta variants causes more severe illness It's a broader demographic. You've heard a younger and younger patient that we're dealing with. Right now, among other children with COVID that are in our hospital, we've got a 15-year-old kid. A 15-year-old kid. Less than 1 week ago, this gentleman was happy, was healthy, was active. He was rarely sick, really had no other conditions. Today, because of this horrible disease, this virus, his kidneys are shut down. His other major organs are compromised. He was supposed to go to high school orientation last week. Instead, his mother's by his side, praying that his kidneys begin to work and that his organs continue to thrive. She used to be skeptical about the vaccination. Now she's pleading to others. If you don't do it for yourself, please do it for your children who can't protect themselves. Again, there's many, many stories throughout all of these healthcare facilities, just like this one. And I think we can get up here and we can talk about numbers, and the numbers are real and they're staggering. But the personal cases, the impact that this virus is having on families, on lives throughout our community, it's real. I had a physician call me 3 days ago. Are the media reports accurate? Is this really what's going on in your hospitals? Is this really what's occurring? This particular physician treats many outpatients. I said, yes, this is occurring. So many in our community don't know the incredible spike that is occurring. We've seen over a 500% increase in inpatient COVID patients over the last month. Today we've got over 64 in our system. Almost 40% of those patients are in the intensive care unit. Again, as Dr. Trawick said, the average age is younger. Our average age is 46 right now. So again, a very dangerous variant, a very dangerous virus, and again, we've got the vaccination to be able to stop this. Again, vaccinations are available all over the community. At all 3 of our hospital campuses, we've got vaccination clinics. Call us. We'll get you in. We'll get you in. We plead to you, please get your vaccination. Please do your research. The evidence is real. Again, I think it speaks for ourselves. In all of these health systems, today, almost 90%, 89.5% of our patients that have COVID or in the ICUs are unvaccinated. So the data speaks for themselves. And again, this is about preserving the quality of care for everyone, not just COVID patients. Again, whether you have a stroke, you've got a trauma, you've got an accident, you've got a chronic disease, you've got cancer, you need other medical care. We can't slow that down. We've got to continue to provide that type of care to all of our citizens throughout North Louisiana. At Ochsner LSU, we provide over 3,700 transfers every year for patients within this community and within other communities throughout North and Central Louisiana that need a higher level of care. Right now, we're not able to provide all of those transfers. Our hospitals are full. Our hospitals are full, and again, many of these things are preventable. We can't stop the care that's going on for these other patients with chronic disease, with heart disease, with cancer. We need to continue to provide that higher level of care. So again, if this trend continues, the ability of our healthcare systems to take care of you when in need and your family in need is compromised. So that's just not about COVID patients. It's about healthcare for everyone. Again, the cure for the pandemic is present. It's vaccination. Please do your research. Please do your education. We've got almost 4 billion vaccinations that have occurred throughout the world since the pandemic started. The evidence is staggering of the effectiveness of the vaccination. As Dr. Trawick said again, and I'm sure Mr. Crawford will tell you, our teams are tired. They're tired. They're working hard. They're working extra shifts every week to take care of our community. Please show them gratitude. They will continue to fight for this community and fight for all of North Louisiana. They'll fight for the families in this in this region, but please help them help you and help your families. Thank you.
Good afternoon. My name is Brian Crawford. I'm the Chief Administrative Officer for Willis-Knighton Health Systems. And so, as my two previous speakers and colleagues have mentioned, I don't have any good news to tell you today. From Willis-Knighton Health System, we continue to see an unprecedented escalation in the COVID-19 Delta variant, causing severe illness and death in our patient populations. Statistically, Willis-Knighton has witnessed a 173% increase over the last 2 weeks and a 1,400% increase over the last month in COVID-positive patients. So let's talk about statistics. People like numbers and they like facts. These are facts. Every one of these speakers that you've seen today and that you'll see come after me, even though one is a politician, he's also a Shreveporter, and he's also part of our family here in Shreveport and Bossier City. And so we're talking to you as a family member today, and we're talking to you as healthcare professionals and people who care. Today in Willis-Knighton, we have 90 COVID patients in our hospital, 87 adults and 3 pediatrics. 77 of those, or 86%, are unvaccinated. 24 of those patients are in our ICU, and 16 of those are currently on ventilators. All age groups, as previously being mentioned, have been affected, with the most significant increase that we have seen is the under 30 population. They take up about 15% of our patient load right now, but that's a 10% increase over what they were last year. 35 to 50 are 44% of our population, and over 60 is 41. That's a significant shift in most of our population that we are seeing in the hospital now is under 50. They're younger, they're healthier, they don't have the comorbidities, and so those who think it can only happen to older patients with healthcare problems, nursing home patients, need to take a good hard look at what we're trying to express this afternoon. Sometimes these numbers can be deceptive. I want to tell you something in the media that you haven't heard before and that hasn't been spoken today as to the actual magnitude of the current crisis. As a social media post yesterday, when we had 76 patients in our health system, so we had about a 12% increase just in the last day. We are providing all of our COVID numbers on Willis-Knighton's Facebook page. So how many patients, how many are vaccinated, how many unvaccinated. So yesterday one of the comments was, and it was an honest comment, well, 76 doesn't seem like a lot of patients, particularly because you have 4 hospitals. That's less than 20 a hospital. And on face value, that's probably true. But that number is the state required reporting number. So when you see a number reported from Christus, or you see a number reported from Oxnard LSU or Willis-Knighton, that is what the state reporting requirement number is. And those are for contagious COVID patients in the hospital. What they don't count are the non-contagious COVID patients and those that have what we call timed out. They've been there long enough to where they are no longer contagious. And so we don't count those numbers in. So you have to add those numbers to our 90 patients today. I have 11 additional COVID patients who have timed out, but they're still in the hospital. Most of those are still on vents because they're some of our sickest patients because they've been there the longest. I have 2 of those on ECMO. So I have over 100 patients in my hospital today that I am treating for COVID. Additionally, yesterday we saw more than 200 COVID patients in Willis-Knighton emergency departments and quick cares in Shreveport and Bossier. That's 22% of every person that walks into an ED has been a COVID patient. And so most of these are being treated with monoclonal antibody infusions and not admitted. But that's no guarantee that their symptoms won't worsen and they won't be back to be admitted. So let's put this into context. When you add all of these positive COVID-19 patients together, the inpatients, the COVID non-contaminant patients that are still in the hospital, and the ED and quick care visits, just the Willis-Knighton facility and our physicians and nurses saw 300 COVID patients yesterday. And that's what we're seeing each day, and that's what the other 2 hospitals, percentage and per capita, are seeing additionally. So we're seeing literally probably close to 1,000 patients a day with all of our clinics, all of our hospitals, all of our emergency rooms, and that number is climbing at an alarming rate. Overall, all of those patients continue to be anywhere between 85 and 90% unvaccinated. The collateral damage we've talked about being caused by numbers of COVID patients, a national nursing shortage, and more than 40 of my clinical care professionals out with COVID themselves is that our hospital EDs are backlogged with patients waiting hours or days in the emergency room for a room to be admitted into. On Tuesday of this week, Willis-Knighton emergency departments were holding more than 40 patients that needed rooms, including 6 ICU patients on ventilators. Imagine if that is you or your loved one in an ER where you can't get admitted. At Willis-Knighton South alone, where I have 21 patient rooms, I had 27 patients waiting to be admitted. I had more than 80 patients in the ER or waiting room waiting to be seen. Because there are no projected models forthcoming from the state on when this latest surge will end, but it is anticipated to be the longest, lasting maybe possibly months into September and October. This current trend is untenable and unsustainable, placing enormous burdens on an already strained, tired, and fatigued mentally and physically healthcare structure and clinical staffs in the state and us in Northwest Louisiana. We are indeed headed into the darkest days of the more than a year and a half long pandemic. So we ask, as the others have, we plead with you to help us help you. Talk to your doctor, not necessarily a politician, about the benefits and protections of the vaccine. Wear your mask in public and continue to social distance and avoid large crowds, particularly if you count yourselves among the unvaccinated, whenever possible. Thank you.
Good afternoon. I'm Pat McGauley. I'm a physician and Deputy Chief of Staff, emergency physician and Deputy Chief of Staff at the Overton Brooks VA Medical Center. And my colleagues have done an incredible job, truly, of outlining the statistics. And just to give you, we treat a very specific population. We treat veterans. And as one veteran to another, I plead with you, please get the vaccine. We can actually do something about this particular virus. To give an example, we have a relatively small emergency department. Monday, I myself diagnosed 10, okay, a small ER, and had to hospitalize 2. Both of those were unvaccinated. So we're all seeing an incredible surge of patients, no matter where you are. The surge is definitely here. Most hospitals have had to do unprecedented expanding of their COVID. And for instance, we went a month ago, we had nobody in the hospital. And today we have 11. Okay, that includes 4 in the ICU and 1 on a ventilator. And we've had to increase our COVID-specific areas from 10 beds to 36 beds and 5 ICU beds to 10. And that's unprecedented at the expansion, and their hospitals are much larger than ours, and I can only imagine how many beds they have to be able to go for COVID. And so what we can do to serve the veterans better, we've expanded the hours of our vaccine clinic. And a veteran, their spouse, their caregiver can walk in and we'll give them a shot, no questions asked. And I personally plead to you, as one veteran to another, to come in and get that shot. You can get them in our community-based outpatient clinics or CBOCs. We're trying to make it as accessible as possible to get that shot. Being an ER physician, I see how young some of these people are that are getting this disease. It's not in the it's still in the nursing homes, but it's not all in the nursing homes anymore. It's now at the granular level. It's your children, it's your younger family members. So again, and I've said it a couple of times, please get vaccinated. We can do something about this. Try to avoid populated, high congested areas. Common sense things. But I have to say, I'm pretty confident from the muscle memory of our prior surges that we'll be able to take care of everybody with this surge. And once again, this one's going to be more challenging, as my colleagues have said. There's no model predicting when this will stop. There's no model that'll say when it'll peak or what the peak will be. And it's already the 2,400 people in the hospital in the state of Louisiana is greater than it was for all the others. So I do have to say this, though. I'm pretty confident that if we all do the right thing, get vaccinated, wear our masks, wash your hands, do those things that you can do at a personal level to prevent this. I don't want to see you in my emergency room. It's not that I don't like you. It's that when you look up and see me, you're having the worst day of your life. So I plead with you, please get vaccinated, wear your masks, do those things that you can personally do to protect yourself and your loved ones. Thank you very much.
Good afternoon. I'm Scott Wolverton, the fire chief. From the fire department's perspective, we've seen an uptick on our COVID responses over the last 3 weeks. It started about the third week in July, and over the last 2 weeks, we've seen about 125% increase in our COVID responses. 51% of those we wound up being transported in that time frame. We're still seeing that increase this week. This week's not over with yet, so we don't have all the numbers for this week, but we're seeing it continuing that trend. We are the pre-hospital care provider for the citizens of Shreveport. We're part of that continuum of care that begins with that patient that calls 911 and is having COVID problems, and that's passed off to our ERs. And you've heard the difficulties and the stresses and things that are going along with that with this recent surge. So we empathize with that. We work with our hospitals very closely. As a fire department, we're partners in the community, providing the best service we can and medical treatment for our citizens. So we're in communication with them daily. We're talking to them, doing everything we can to help with their situation that they have and the overload and lack of staffing that they have. So we're working with those. As a department, we're in pretty good shape as far as personal protective equipment goes. We have good inventory of personal protective equipment to protect our members that are responding out there. We have a solid COVID protocol that's been established by our 3 medical directors. We have a medical director from each of our 3 major hospitals here in town that represent all the 3 hospitals. We're very thankful for their wisdom and their guidance and allowing us as paramedics and EMTs to provide medical services to our citizens. And we lean on them for guidance in our COVID protocol. So we just updated that protocol. It gives us a little bit more flexibility as far as on-scene care and also seeking medical control guidance. And last would be vaccinations. As one of the largest components of public safety for the city of Shreveport, we promote vaccinations for our entire city for anyone who's not had it. I can tell you this on the Shreveport Fire Department, here recently, probably in the last month and a half, 2 months, where we've seen the COVID cases start coming back, every one of our members on the fire department who contracted COVID chose not to be vaccinated. That's a solid fact. Just this morning, very proud to say we've been providing vaccinations for our city employees. We did 24 this morning. We're working with the community also with Dr. White, providing vaccinations for homebound, and this weekend we'll be participating also in providing those vaccinations that are at our city facilities that are being provided. So we want to encourage our community, get your vaccination, wash your hands, wear your mask, and social distance when you can. Follow all those things that we were doing. It's obvious we got relaxed. It was nice being a little relaxed. But now we are where we are now, and we've got to do those things that need to be done to protect ourselves and to bring this spike back down. So thank you for the opportunity to speak today.
All right, the politician is back. Now, I'm not even mad at Brian for singling out me as a politician. I'm mad at everybody that laughed in the audience, by the way. It's just about everybody. Yeah, that's true. Yeah, that is true. Thank you. He called me family as well, and I wear a bunch of hats. I'm a veteran as well, so we're grateful for the VA for being here today and being present. And on a more serious note, I will end very reminiscent in the way that I began. So last year at this time, we were getting national coverage from the Washington Post as a community that set an example throughout the country in identifying hot spots in our community, making sure that we let the neighborhoods and the people know that we're being disproportionately impacted by this virus, getting out in front, letting them know that they were being disproportionately affected, and not only putting out that messaging, but putting resources on top of those spots. And we saw a precipitous drop of viral spread in our community. Fast forward the clock this year, and we find ourselves back in the national spotlight. We were on the front page of the New York Times. I've been on MSNBC. Rachel Maddow's show has talked about us. Just this morning, I opened up the White House webinar, and it's not good. We are a case study, the bad kind of case study, and the country is watching us. We have an opportunity to once again be a community that everybody looks to for doing the right thing. We have an opportunity in this moment to do the right thing. So we need everybody to get vaccinated as quickly as possible, because we have all made so many sacrifices over the last year. This is a sacrifice in getting the vaccine that could end the pandemic. Let's not fall short when we're this close to the finish line. Let's make sure we are doing the right things. The last thing I'll say is this. This community has lost over 700 of our citizens, and we've talked a lot about numbers today. And as you can see, the numbers that are reported actually are masked a bit and don't actually show the numbers that our healthcare workers have to deal with on a day-to-day basis. But this is the number that I go to sleep with at night, and that's that we lost over 700 of our friends, of our family members, co-workers. And when I talk to those healthcare workers that are on the front lines and I ask them, hey, what's going on? What are you hearing? They say, without fail, every time that we lose a member of our community that the family says, or that if it was a citizen that was extremely sick and survived, they always say, I wish I'd taken the vaccine. It's our job as leaders in this community to protect our community and stop those instances of reflection so that we can move forward past this. That concludes my remarks, and at this time, the hospital leadership and myself will begin to take questions.
Quick question for Fire Chief. Did you say that Chief, you said all of your firefighters who contracted COVID were not vaccinated? Is that what you said?
That's correct.
Why aren't they vaccinated?
Because they chose not to. From the beginning, I've encouraged our department and everyone I speak to, do your research on the 3 vaccines. Do your solid research, your peer-driven research, not something you read on Facebook or social media. Do your solid research. Talk to your doctor and make the best decision for you and your family. You know, that's what I did. I did those 3 steps exactly. And those are the things I've encouraged every member on our department and everybody that I speak with. Those are the 3 things I tell them to do. And then make your best decision. So.
And still on the, not that topic, but about COVID. What's it like for the medic units to come into, say, a hospital's emergency room? What's it like in there?
It's very busy. It's very busy. There's sometimes some wait times and things like that. You heard the numbers. When you've got only 21 beds in in an ER and you got 27 people waiting, those numbers just don't add up. And there's a backlog. So that's why I said we're trying to do everything we can, partnering with the hospitals and trying to find solutions to try to ease up some of that overload that they have. And that's difficult right now. And right now we're just basically working with what we have and doing our best that we can. And that's what we'll continue to do. You know, that's the thing about this community and this health systems that we have here and your fire department, your EMS providers. We work together, and we always do the very best that we can with what we have, and we do it well. Yes, sir.
Just a question for the mayor. My paper started a "Don't Be a Snot, Get a Shot" and dispersed $1,000 to winners. We had over 1,000 people. This weekend, you're having the clinics where they can receive $100. Does the business community need to help raise more money to encourage people to get the shot, or what? We're going to wait and see how it goes, or how else can we do this?
Yeah. Well, John, first of all, thank you for what you did. Clearly, your campaign worked, and I guess we should have took note earlier. Thank you for what you did. We'll be doing it this weekend, but there is not enough resources we can throw at this in this moment. If you think about the economic impact of last year, the city itself, we estimated we would have a $25 million shortfall just from the city standpoint. We were fortunate that we had about a $14 million shortfall. But businesses across our community, if we go into shutdowns that we went through in 2020, could face similar hits, financial hits. So at this time, there is no amount of, there's no resources that we would turn down. We, as a community, need to be as aggressive and as innovative as well to get our fellow citizens vaccinated. So if the business community would like to raise funds, we will gladly partner with them, and we will gladly encourage our citizens to come out and get those shots.
I'll volunteer those business leaders that aren't here.
Question for a physician or in the hospital system.
That is not me.
Yeah, I wanted to ask you, right now, as more and more kids go to school, right now we're seeing a trend of kids getting the virus and everything. Are you nervous that this could create literally dozens of kids to catch the virus, and that maybe schools should kind of rethink about having school sessions go back until this is all kind of gone down and everything?
That's a loaded question there. I think that's more for the politician here.
Where's the school?
I mean, really, that's a sort of a two-part question, and I would say, am I fearful from big groups of people, especially children, coming together and spreading the virus? Absolutely, I'm worried about that. I will tell you what has worked, and I'll use an example of a school system that I think did it very well this year. Well, this past year was Loyola College Prep. They kept their kids in school 5 days a week. They went regular schedule. They all wore masks. They had disinfectant. They spaced out appropriately in the classrooms. And they had a very low infectivity rate. So I think it can be done, but it's got to be done with the help and cooperation of the school system, of the teachers and faculty, of the students, and probably most importantly, the parents. And it's got to be a coordinated effort, but yes, I'm extremely concerned about that. You heard from both Chuck and Brian that we are seeing children in our hospitals that are very young. And so I think it's a reality that we've got to be very careful about, and we've got everything at our disposal. I mean, if you're of age right now, I encourage you to take your child to get the vaccine. I do think that there's been some great studies. Dr. Van Cherry at the med school and Dr. Kevel have been leading some research for the Pfizer vaccine in children, young children. I heard Dr. Bocchini on the news the other day talking about, as a pediatric infectious disease specialist, that there's some trials coming out that we may be very soon all the way down to 6 months. But when that becomes available and recommended, I encourage that to be done. As far as rethinking going back to school, kids need to be in school. Kids need education, and this is strictly my opinion, that they need to be in the classroom, not only for the educational piece, but for the socialization. Strictly my opinion, but you've got to do it safely. I heard Dr. Gorey talk on the news the other day about the LEAP scores were down in children that were not in class and not going to school or doing virtual school or not in 5 days a week. So I think that let the results speak for themselves.
Doctor, would you encourage people to not wait till it gets so bad, maybe go to one of the work care type places? How would you describe or tell people?
The question is, should people get help sooner than later? And absolutely. We have treatment for this. The monoclonal antibodies that you've heard about, that's a game changer. We have seen tremendous success, and I know for our hospital system, we have seen a very low admission rate on patients that we've been able to get the monoclonal antibodies for. It really helps and really works well. So when you get those symptoms, if you've been exposed and then get symptoms, go to your primary care physician, go to an urgent care center. Just to get a test for COVID with really no symptoms or trouble breathing, it's not smart to go to the emergency department. We can't handle that right now. There are other avenues to go and get a test. I would say that if you're having trouble breathing, if you're having chest pain, if you're coughing excessively, if you're running high fevers, that's what the emergency department's for.
One quick question. You just answered my first one. Now, obviously, I know that things looking pretty grim from a healthcare perspective. Unfortunately, things continue to go not to be great. Have you all already started thinking about that you all may have to suspend several surgeries or certain kind of care like y'all did earlier during this pandemic?
I think all of us are looking at ways to make sure that the patients that are coming to and are in our hospital are getting the care that they need, efficiently. And some of those mitigation strategies include limiting surgeries or surgeries that require admissions. I think all of us are doing some form of that right now. I will say for us, we made an application to the federal government for some assistance with some staffing. And we actually had a wonderful meeting this morning at 10 a.m. with a group out of D.C. To look at some ways that they can help us with staff. So, there are lots of things that we can do. It's, as the mayor said, this is not normal times, and we're having to all look at how we have always done things is not the way we can do it today. And so we're all making those adjustments to make sure that the patients in the community are served.
Hey, Knox, can I ask you a question? Mr. Ann. What we got?
What's that, Bob?
Dr. White's not here. Could you
No, she's
describe-
unable to come.
Yeah. Can you describe what's going on in the other parishes in this region?
I'm sorry.
Can you describe how it's going in other parishes in this region?
Yeah. So in Region 7, we have 31 hospitals total, and they include not only hospitals that have emergency rooms, such as the hospitals represented here in the room right now, but we have other hospitals. We have rehabilitation, psychiatric, long-term acute care facilities throughout Region 7. In the rural areas, we have COVID ongoing in our rural areas. It's been a little bit slower to come on in our rural hospitals, but it's starting to pop up now. And I'm starting to get the calls about, hey, I've got patients I need to move to the big city. I need to go to a higher level of care with these patients, but they're having trouble because we have issues with available beds. So to your point, Bubba, COVID cases are starting to increase in our rural areas. It's been a little bit slower than has been occurring here in Shreveport-Bossier, but those numbers are rising. I should go on to say that actually here in Region 7, we're a little bit more fortunate. If you looked at the state numbers in the other regions, you could see that the regions down south, actually their numbers started increasing at a greater rate and a little bit earlier than ours here in Region 7. And you can see this data if you go to the Louisiana Department of Health's website, their COVID website. Their there's a lot of data that's on there, but there's one page that's hospitalizations and ventilator use. And you can actually filter that by regions, so you can actually keep track and have awareness of, what is going on, and see this information for yourselves.
One more question. Hopefully this is some good news here. So, are we seeing a massive increase of more people getting vaccinated? Is that something that you all are seeing a large increase?
Are we seeing a massive increase?
Or just a larger increase?
I
of
think
more
we're
people?
seeing a greater increase, and I don't have any numbers that I can give you off the top of my head, other than to then point you to the same LDH website where we do post vaccination updates on Mondays at noon and on Thursdays at noon. So you can go to that website and you can see by parish and actually, well, by region. I think you can drill it down to the parish to see numbers of vaccinations. But those numbers are starting to increase, but it's not fast enough. I mean, I tell people now, if you haven't been vaccinated, don't walk to get your vaccination, run to get your vaccination. And so I want to share a little personal story. Last 2 Fridays ago, I was working in my office, and the gentleman that came in to help clean up my office came in. I had a little conversation with him. Turns out we both went to Byrd High School and graduated in '76. And I said, well, have you been vaccinated yet? And he goes, well, no, I really haven't had a chance to yet, and I don't know where to go on the weekends. And so I gave him some places that he could go on the weekend. He came back Monday, and while I was talking on the phone, he rolls up his sleeve and shows me his Band-Aid. And, I got off the phone, and he said, well, my wife and I decided to go get vaccinated, and so we went yesterday to our local drugstore, and we got vaccinated. That was a success story. And if everyone could reach out to someone and say, hey, have you been vaccinated, Mr. Mayor? And if he hadn't had that conversation with him and maybe possibly give him some incentive and reason to go get vaccinated, that's a success story. So anyhow, we're making progress with vaccinations, not fast enough.
Our health care leaders will make themselves available for vaccinations. Thank you so much for joining us.
Thank everyone for taking the